Welcome all for the today's class. So we continue with our recall and revise series. As our exam is near, this series will definitely help you for the examination. Dr. Sansi, can you please start with this first question?
Yes, yes, a 30-year-old woman is diagnosed with vulvovaginal candidiasis and is prescribed fluconazole. Which of the following best describes the mechanism of action of fluconazole? Inhibits the fungal DNA synthesis, binds to fungal cell wall chitin, inhibits beta-glucan synthesis in fungal cell wall, inhibits fungal ergosterol synthesis by blocking ionosterol 14 alpha demethylase, disrupts fungal protein synthesis by binding to ribosomes. So option D.
Inhibits fungal ergosterol synthesis by blocking lanosterol 14 alpha demethylase. Yes, it is a D. Inhibits fungal ergosterol synthesis by blocking lanosterol 14 alpha demethylase. Fluconazole is a triazole antifungal that works by inhibiting the fungal cytochrome P450 enzyme, lanosterol 14 alpha demethylase, which is essential for ergosterol synthesis. Ergosterol is a key component of the fungal cell wall. Inhibition leads to the defective cell membrane and fungistatic activity. So other options are not correct. A is incorrect, not the primary action of fluconazole. Chitin is targeted by other agents like nicomycin. Then beta glucan synthesis is inhibited by echinocandis. This example is a caspofungin, and protein synthesis is a target of antifungals like grisofulvin or antibacterials, not fluconazole. Okay. Next, doctor. Wait. A 2 week old, 2 week old. Yes, start.
Yes. A 2-week-old newborn is brought to the pediatric clinic with a history of bilateral conjunctival discharge and eyelid swelling. That started 5 days ago. 2-week old, but it has started 5 days ago. The mother was asymptomatic during pregnancy and had no known infection. On examination, the baby is afebrile and active. There is no purulent nasal discharge or rash. A conjunctival swab is sent for the testing. Which of the following organism is most likely cause of the neonatal condition? Neisseria gonorrhea, herpes simplex virus, chlamydia trachomatis, cytomegalovirus, trichonoma pallidinum. Sir, Neisseria gonorrhea.
Let us see the answer. The answer is chlamydia trachomatis. There is a difference between the chlamydia trachomatis and the Neisseria gonorrhoeae, especially with respect to the conjunctivitis. We will see. Chlamydia trachomatis is a common cause of neonatal conjunctivitis, typically presenting between 5 to 14 days after the birth. It may cause pneumonia in neonates. Neisseria gonorrhoeae causes early onset conjunctivitis within first 5 days. Okay. HSV presents with vesicular lesions and can lead to keratoconjunctivitis or systemic infection. CFV and Trypanosoma pallidum typically present with more systemic features or are detected via torch screening. Next.
A 28-year-old woman in active labor has positive rectovaginal swab for group B streptococcus colonization. She has documented history of anaphylaxis to penicillin. Which of the following is the most appropriate antibiotic or intrapartum prophylaxis in this patient? Okay. Ampicillin, cefazolin, clindamycin, erythromycin, vancomycin. Group B streptococcus anaphylaxis to penicillin. Actually, ampicillin and clindamycin both can be used, sir. Option C,
No.
clindamycin.
No. You have to go for vancomycin. Okay. So this is a very typical from the guideline. There is a special guideline for on this group B streptococci. So first line intrapartum prophylaxis for GBS is a penicillin or ampicillin. That is the straightforward. Okay. For penicillin allergic women, the choice depends on the type of allergy, mild versus anaphylaxis, antibiotic susceptibility of GBS isolate. If the allergy is non-anaphylactic, cefazolin is used. If the allergy is anaphylactic and GBS is susceptible to clindamycin, then clindamycin is given. If susceptibility is unknown or resistant, then vancomycin is recommended. Okay, but new guideline directly mentions the vancomycin. The clinda, I don't think it must be older. Okay, but vancomycin is the preferred agent. In this case, due to anaphylaxis and no mention of susceptible, vancomycin is the safest and most appropriate choice. Next.
Yes. A 32-year-old pregnant woman in her third trimester presents with large anterior neck swelling that has gradually increased in size. She reports a recent onset of hoarseness. a voice and mild difficulty in breathing when lying down. On examination, diffuse goiter is noted with no tenderness. Which of the following nerve is most likely compressed due to enlarged thyroid gland? Thyroid gland. Glossopharyngeal nerve, recurrent laryngeal nerve, hypoglossal nerve, phrenic nerve, accessory nerve. So option B, recurrent laryngeal nerve.
Yes, it is a recurrent laryngeal nerve. The recurrent laryngeal nerve, a branch of vagus nerve, passes near the tracheoesophageal groove and behind the thyroid gland. It is most commonly compressed or injured in cases of large goiters, thyroid malignancy, or thyroid surgery. Compression leads to hoarseness of voice due to vocal cord paralysis. So other options like glossopharyngeal and hypoglossal nerves are more cranial and not near the thyroid. Phrenic nerve runs along the lateral neck and is not usually affected by the goiter. Accessory nerve supplies the sternocleidomastoid and trapezius and not typically affected by goiter. Next.
Which of the following HIV component does not enter the host cell during the process of viral infection? Reverse transcriptase, integrase, RNA genome, capsid protein, envelope glycoprotein GP120. Sir, option E, envelope glycoprotein GP120.
Yes, option E is correct. Envelope glycoprotein GP120. HIV enters host cells, typically CD4 plus T cells, by binding of GP120 to the CD4 receptor and co-receptor CCR5 or CXCR4. This is followed by membrane fusion mediated by GP41, allowing the viral genome reverse transcriptase, integrase, and other enzyme proteins like capsid to enter the cytoplasm. However, the envelope glycoprotein GP120 and GP41 remain embedded in the viral envelope, which fuses with the host membrane. So they do not enter the host cell cytoplasm. So other options like reverse transcriptase enters the host cell to convert viral RNA to DNA. Integrase required for integration of viral DNA into the host genome. RNA genome, the genetic material of the virus necessary for replication. Capsid proteins initially enter but are later disassembled during the uncoating. Next.
A medical student is studying the embryological development of the face and the neck. He learns that each pharyngeal arch gives rise to specific muscles, bones, and nerves. Which of the following structures derive from the second pharyngeal arch? Stylopharyngeus muscle, mandible, stapes, thyroid cartilage, superior laryngeal nerve. Sir, option C, stapes.
Which of the following structure is derived from the second pharyngeal arch? Stapes is it the only stapes? Yes, stapes. The second pharyngeal arch, also called a hyoid arch, gives rise to skeletal derivatives, stapes, middle ear ossicle, styloid process, lesser horn and upper part of the body of the hyoid bone, stylohyoid ligament. Muscles of facial expression, stapedius, stylohyoid, and posterior belly of digastric. Nerve is a facial nerve. Okay. So other options like stylopharyngeus from the third arch, innervated by glossopharyngeal nerve, mandible from the first arch, thyroid cartilage from the fourth and sixth arches, superior laryngeal nerve branch of vagus associated with the fourth arch. Next, doctor.
The allantois is an embryonic structure that contributes to the formation of urachus and helps in early fluid and waste exchange. From which of the germ layer or embryonic tissue does the allantois origin? Surface ectoderm, neuroectoderm, peraaxial mesoderm, endoderm, intermediate mesoderm. So option D, endoderm.
This is previously also we have seen this. The allantois is derived from the endoderm of the yolk sac. It appears around day 16 of embryonic life as an outpouching from the hindgut region and extends into the connecting stalk. In humans, it becomes the urachus, which later forms the median umbilical ligament. This is also single best answer question. Okay, so surface ectoderm forms the skin and lens of the eye. Neuroectoderm forms the brain, spinal cord, retina. Paraxial mesoderm forms the somites, which give rise to muscle, bone, and dermis. Intermediate mesoderm forms the urogenital structures, but not the allantois. Next.
A 29-year-old woman presents with chronic pelvic pain, dysmenorrhea, and dyspareunia. Laparoscopy reveals lesions consistent with endometriosis. Which of the following is the most commonly involved structure in endometriosis? Uterosacral ligament, ovaries, rectovaginal septum, fallopian tubes, urinary bladder. So option B, ovaries.
Ovaries are the most common. So the ovaries are the most common site for endometriotic implants. Endometriomas, chocolate cysts are frequently found on the ovaries. Other commonly involved sites include uterosacral ligaments, pouch of Douglas, rectovaginal septum, peritoneum. Okay. Then other options, uterosacral ligaments, commonly involved but not the most common. Rectovaginal septum, more typical in deep infiltrating endometriosis. Fallopian tubes may be affected but less common. Urinary bladder seen in bladder endometriosis, but it is a rare. Okay, next.
What type of epithelium covers the surface of the ovary? Stratified squamous epithelium, simple cuboidal epithelium, germinal epithelium, simple columnar epithelium, simple squamous epithelium, transitional epithelium. So option B, simple cuboidal epithelium, germinal epithelium.
Yes, B. Simple cuboidal epithelium, that is the germinal epithelium. The ovarian surface is covered by simple cuboidal epithelium, which is called the germinal epithelium. This layer is continuous with the mesothelium of the peritoneum, but is distinct because it is cuboidal rather than squamous. It is also called germinal epithelium historically, though it does not produce germ cells. So, option stratified squamous epithelium found in the vagina and ectocervix. Simple columnar epithelium lines the endometrium, uterus, not ovary. Simple squamous mesothelium lines most of the peritoneal surfaces, but ovary surface is cuboidal. Transitional epithelium found in the urinary tract. Next, doctor.
Yes, sir. A 55-year-old female presents with painless hematuria. Okay, cystoscopy reveals a papillary growth on the bladder wall. A biopsy is taken. Papillary growth, painless hematuria. What is the most likely histological type of bladder carcinoma? In this case, squamous cell carcinoma, adenocarcinoma, transitional cell carcinoma, small cell carcinoma, clear cell carcinoma. So option C, transitional cell carcinoma.
Yes, option C, transitional cell or urothelial cell carcinoma. The most common type of bladder cancer presenting as a papillary lesion is a transitional or urothelial cell carcinoma. It arises from the urothelium lining the bladder and often presents with painless hematuria. Squamous cell carcinoma is less common and usually associated with chronic irritation like schistosomiasis. Adenocarcinoma and other rare types are not very common. Small cell carcinoma is rare and aggressive neuroendocrine tumor. Next, doctor.
Yes, a 60-year-old woman presents with persistent ulcerative lesion in the vulva. Persistent ulcerative lesion. Okay. A biopsy confirms malignancy. What is the most common histological type of vulval carcinoma? Squamous cell carcinoma, basal cell carcinoma, melanoma, adenocarcinoma, sarcoma. Sir, option A, squamous cell carcinoma.
Yes, squamous cell carcinoma. Squamous cell carcinoma (SCC) accounts for around 90% of vulval cancer. It usually arises in the labia majora, that is also SBA, and is often linked to HPV infection or chronic inflammatory conditions. The other types like basal cell carcinoma, melanoma, they are less common. Adenocarcinoma and sarcoma of the vulva are rare. Vulva is more frequently asked, either lichen sclerosis or lichen planus. These things can also be asked. So please listen to those videos also. Vulva, no examination without vulva, remember. Next.
A 48-year-old woman presents with abdominal distension, pleural effusion, and ascites. Abdominal distension, pleural effusion, and ascites. Okay. Imaging reveals an ovarian mass. Or after surgical removal of the mass, both the ascites and pleural effusion resolves. What is the most common type of ovarian tumor causing Meads syndrome? Serous cystadenoma, fibroma, granulosa cell tumor, mucinous cystadenoma, thecoma. Sir, option B, fibroma.
It is a fibroma. Mixed syndrome is characterized by the triad of ovarian tumor, usually benign, ascites, and pleural effusion that resolves after the removal of the tumor. The most common tumor causing mixed syndrome is ovarian fibroma, a benign sex called stromal tumor. Other tumors like thecomas, granulosa cell tumor can occasionally cause similar picture but are less common, and serous and mucinous tumors rarely cause mixed syndrome. Next, doctor.
What is the term for an increase in the size of individual muscle mass? Hyperplasia, hypertrophy, atrophy, metaplasia, dysplasia. So option B, hypertrophy.
Yes, hypertrophy refers to an increase in the size of individual cells, leading to enlargement of the tissue or organ. In muscle, hypertrophy occurs due to increased workload or stimulation. Hyperplasia is an increase in number of cells. Atrophy is a decrease in cell size or number. Metaplasia is the irreversible change from one differentiated cell type to other, and dysplasia is an abnormal cell growth and maturation. Next.
A newborn delivered by forceps assistant shows facial asymmetry, inability to close the eye on one side. Okay. And drooping of the mouth. Which of the cranial nerve is most likely injured during forceps delivery? Cranial nerve, fifth trigeminal nerve, seventh facial nerve, glossopharyngeal nerve, vagus nerve, accessory nerve. Facial asymmetry, inability to close the eye on the one side, and drooping of the mouth. So it is consistent with facial nerve. Option B.
So cranial nerve, the 7, that is facial nerve. Forceps delivery can cause trauma to the facial nerve or cranial nerve 7 as it passes through the parotid region. Injury leads to the facial palsy presenting as a loss of facial expression on the affected side, inability to close the eye, lack of thalamus, and drooping of the mouth corner. Other cranial nerves listed do not control facial muscles. Next.
A patient tests positive for BRCA1 gene mutation, which of the following best represents her approximate lifetime risk of developing breast and ovarian cancer? BRCA1, no? Okay. For breast cancer, 50%, then 10%, 60% or 40%, 40% or 20%, 70% or 50%, 30% or 50%. So option D, 70% or 50%.
It should be B. I'm not sure.
I think
Let's
so.
say
BRCA2.
B. Yeah. Breast cancer 60% and ovarian cancer 40%. Okay. Women with BRCA1 mutations have a lifetime increased breast cancer risk approximately 55 to 65% and ovarian cancer risk around 39 to 46%. These risks are significantly higher than the general population. The exact percentage can vary slightly in studies, but option B is the nearest one. Next.
A 35-year-old male presents with scrotal abscess. Okay, the clinician is concerned about potential lymphatic spread of the infection. Which group of lymph node is responsible for the lymphatic drainage of the scrotal skin? Para-aortic lymph node, internal iliac lymph node, external iliac lymph node, superficial inguinal lymph node, deep inguinal lymph node. So scrotal skin, superficial inguinal lymph node, and testis, para-aortic lymph node. So option D.
Yes, option D, superficial inguinal lymph nodes. The scrotal skin drains to the superficial inguinal lymph nodes. This is similar to the drainage pattern of the other external genitalia. In contrast, the testes will drain to the para-aortic or lumbar lymph nodes, reflecting the embryological origin of the posterior abdominal wall. So, para-aortic nodes for testes, then internal iliac nodes for pelvic organs like prostate, external iliac nodes for deep pelvic structures, deep inguinal nodes drain deeper portions of the penis, clitoris, and glans. Next.
During embryological development, the ureteric bud gives rise to structures such as ureter, renal pelvis, calyces, and collecting duct. From which of the following embryological structure does the ureteric bud arises? Metanephric mesenchyme, pronephric duct, cloaca, mesonephric duct, allantois. So option D, mesonephric duct, Wolffian duct.
Yeah, very frequently asked question, mesonephric or Wolffian duct. The ureteric bud arises as an outgrowth from the mesonephric Wolffian duct around 5th week of development. It inverts the metanephric mesenchyme, which in turn gives rise to nephrons. The ureteric bud will form ureter, renal pelvis, major and minor calyces, and collecting ducts. So other options like metanephric mesenchyme give rise to nephron structures. Then pronephric duct regresses early. Cloaca forms the parts of the bladder and rectum, and allantois contributes to the urachus part of the bladder development. Next, doctor.
During embryological development, the trigon of the bladder has different origin compared to the rest of the bladder. Okay, from which of the following embryological structure does the trigon of the bladder develop? Endoderm of the urogenital sinus, mesonephric duct, paramesonephric duct, metanephric blastema, allantois. So option D, metanephric duct.
Trigon of the bladder.
I think
It is coming from mesonephric or Wolffian ducts. The trigon of the bladder is formed from the incorporation of the caudal ends of the mesonephric ducts into the posterior wall of the developing bladder. This portion is mesodermal in origin, in contrast to the rest of the bladder, which is derived from the endoderm of the urogenital sinus. Over time, the endodermal lining overgrows the trigon, but its mesodermal origin remains embryologically significant. This is very important question. So, endoderm of the urogenital sinus forms the most of the bladder. Then paramesonephric ducts will form the female reproductive system. Metanephric blastema forms the nephrons of the kidneys. Allantois forms the urachus and the part of the bladder dome. Next, doctor.
A surgeon is repairing a lower abdominal wall hernia. During dissection of the posterior surface of the rectus abdominis, a significant artery is encountered ascending deep to the muscle and supplying the anterior abdominal wall. Okay, a surgeon is repairing lower abdominal wall hernia. During dissection of the posterior surface of the rectus abdominal, significant artery is encountered. Okay, ascending deep to the and supplying to the anterior abdominal. Which artery is most likely described? Superior epigastric, inferior epigastric, deep circumflex iliac artery, superficial epigastric, external iliac artery. So option B, inferior epigastric artery.
Posterior surface of the rectus abdominis muscle, inferior epigastric artery. The inferior epigastric artery arises from the external iliac artery just above the inguinal ligament, ascends within the rectus sheath posterior to the rectus abdominis muscle, supplies the lower anterior abdominal wall, anastomosis with the superior epigastric artery. It is also an important landmark for identifying direct versus indirect inguinal hernias. So medial versus lateral to the vessel. Okay. So hernias are also very important from examination point of view. Superior epigastric artery, continuation of the internal thoracic artery, supplies the upper abdominal wall. Deep circumflex iliac artery supplies the lateral abdominal wall. Superficial epigastric artery supplies superficial structures of the lower abdominal wall. External iliac artery, parent vessel of the inferior epigastric, but not direct supply. Next, doctor.
A 30-year-old woman presents with cyclical lower abdominal pain. She describes the pain as being felt in the periumbilical region, okay, and sometimes radiating to the medial thigh. Okay? On pelvic examination, no local tenderness is elicited, but ultrasound shows a small ovarian cyst. Which of the following structure is most likely responsible for this pattern of preferred pain? She describes the pain in perineum. Uterus, ovary, urinary bladder, rectum, fallopian tube. Oh, sir, option B, ovary.
Yes, the ovary receives its visceral sensory innervation via T10, T11 spinal segments, which corresponds to the periumbilical dermatom. Referred pain from the ovary is typically felt around the umbilicus and sometimes on the medial thigh due to shared innervation with the obturator nerve. This explains referred pain in conditions such as ovulation pain or mesomus or ovarian torsion. So, uterus pain is referred to the lower abdomen or sacral region. T12 and L1, S2 to S4, bladder, suprapubic area, rectum, sacral region. Fallopian tube may cause lower abdominal pain, but not typically periumbilical or thighs. Next.
A 28-year-old athlete presents with groin pain aggravated by the hip flexion. Okay, on examination, iliacus muscle is tender and weak during active hip flexion. Which of the nerves supplies the iliacus muscle? Obturator nerve, genitofemoral nerve, lateral cutaneous nerve, femoral nerve, iliohypogastric nerve. Hip flexion, sir, option D, femoral nerve.
The iliacus muscle, which works with the psoas major as a part of iliopsoas group, is responsible for hip flexion. It is innervated by femoral nerve L2 to L4, which is also supplies the anterior thigh muscles. In contrast, obturator nerve supplies the medial thigh, that is adductors. Genitofemoral nerve provides sensory innervation to the upper thigh and genital area. Lateral femoral cutaneous nerve is sensory to the lateral thigh, and iliohypogastric nerve supplies the abdominal wall muscles. Next.
A 35-year-old woman presents with new onset hypertension and weakness. Okay. Blood test reveals hypokalemia and metabolic alkalosis. Further test confirms elevated aldosterone level and suppressed plasma renin activity. It is talking about Cohen syndrome. Which of the following is the most characteristic clinical feature of hyperaldosteronism? Hypernatremia with polycythemia, hypertension with hypokalemia, bradycardia with hyponatremia, hypercalcemia with muscle thickening, hypotension with hyperkalemia. Sir, option B, hypertension with hyponatremia with hypokalemia. Option B, sir.
So it is the hypertension with hypokalemia. Primary hyperaldosteronism is a Cohen syndrome characterized by hypertension, hypokalemia, and metabolic alkalosis. Hypertension due to sodium and water retention, hypokalemia due to renal potassium loss, metabolic alkalosis due to hydrogen ion loss. Hypernatremia is usually mild due to compensatory water retention. Suppressed renin levels are key diagnostic clue. Other options involve findings not typically associated with aldosterone excess. Next.
Yes, sir. A patient with renal artery stenosis is found to have elevated plasma renin levels. Okay. Renin play a key role in the regulation of blood pressure via the renin-RAS system. Which of the following cells is responsible for the secretion of renin? Podocytes, macular denser cells, JG cells, mesangial cells, principal cells. Sir, option C, JG cells.
So juxtaglomeralar cells or GG cells, also called granular cells, are specialized smooth muscle cells in the afferent arteriole near the glomerulus. Thus, they synthesize and release renin in response to decreased renal perfusion pressure, sympathetic stimulation, that is beta 1 receptors, and signals from the macula densa cells, that is low sodium. So other options like podocytes, filtration barrier component, macula densa senses sodium in the distal tubule, signals JG cells, mesangial cells, structural support and filtration regulation, and principal cells involved in the sodium and water reabsorption in the collecting duct. Next.
Yes, sir. In fetal circulation, the ductus venosus plays a key role in directing oxygen-rich blood from the placenta towards the fetal heart. Yes, ductus venosus. Okay, which vessel does the ductus venosus directly drain into? Inferior vena cava, superior vena cava, hepatic portal vein, right atrium, umbilical artery. Sir, option A, inferior vena cava.
Yes. Shunts, there will always be one question on the shunt. Okay. So correct answer is inferior vena cava. Ductus venosus is a fetal shunt that bypasses the liver, allowing the oxygenated blood from the umbilical vein to directly drain into the IVC. This helps to deliver well oxygenated blood to the fetal heart and brain. After birth, the ductus venosus closes and becomes ligamentum venosum. Okay. Other options like superior vena cava drains deoxygenated blood from the upper part of the body. Hepatic portal vein receives the blood from the gut, not part of this shunt. Then right atrium receives blood from IVC, but not directly from the ductus venosus. And umbilical artery carries deoxygenated blood from the fetus to the placenta. Next.
Yes, sir. A patient is being studied for disorders related to serotonin deficiency. Okay, the synthesis of serotonin in the body begins with hydroxylation of which amino acid? What is the precursor molecule for serotonin synthesis? Tyrosine, phenylalanine, histidine, tryptophan, glutamine. Tryptophan. So option D.
Serotonin or 5-HT is synthesized from the amino acid tryptophan. Tryptophan via tryptophan hydroxylase 5-hydroxyl tryptophan, that is 5-HTP. 5-HTP via aromatic L-amino acid decarboxylase will form serotonin, that is 5-HT. Tryptophan is thus the essential precursor for serotonin synthesis. Tyrosine is a precursor of dopamine and norepinephrine and epinephrine. Phenylalanine converted to tyrosine. Histidine, a precursor of histamine, and glutamine, precursor of GABA and glutamate. Next.
Yes, a 28-year-old pregnant woman at 32 weeks of gestation suddenly collapses and becomes unresponsive in the clinic. Her pulse is weak and blood pressure is low. What is the most immediate and life-saving action to be taken by the healthcare provider? Start IV fluid and administer the oxygen. Perform lap plateau to relieve the aortocaval compression. Call for emergency C-section, intubate and secure the airway. Check blood glucose level. So the option B, because we will do that actually. Option B.
That is the first thing which you are going to do.
B and A,
Okay.
sir, actually both.
So perform left lateral tilt to relieve aortocaval compression. In a pregnant woman, especially beyond 20 weeks gestation, the gravity uterus can compress the inferior vena cava and aorta when she is supine, leading to aortocaval compression syndrome, causing hypotension and collapse. The immediate action is to relieve the pressure by placing the patient in the left lateral tilt position or manually displacing the uterus to the left, which restores the venous return and cardiac output. Simultaneously, oxygen and IV access should be established, but the first priority is to relieve the aortocaval compression. Emergency cesarean is considered if maternal resuscitation fails or if there is a fetal distress. Airway management and glucose checks come after stabilizing the circulation. Next, doctor.
Yes, sir. A 45-year-old man is prescribed finasteride for benign prostatic hyperplasia. Finasteride helps reduce prostate size by blocking the formation of DH3. What is the mechanism of finasteride? Alpha-1 adrenergic receptor antagonist, 5-alpha reductase inhibitor, aromatase inhibitor, phosphodiesterase 5 inhibitor, androgen receptor blocker. So option B, 5-alpha reductase inhibitor.
Mechanism of action of finasteride is by blocking the 5-alpha reductase. So 5-alpha reductase inhibitor. Finasteride inhibits the enzyme 5-alpha reductase, which converts testosterone to dihydrotestosterone, the active androgen responsible for prostate growth and the male pattern baldness. By decreasing DHT levels, finasteride reduces prostate size and hair loss. So other options like alpha-1 blockers, tamsulosin relax smooth muscle in the prostate and bladder neck, but do not affect the hormone levels. Aromatase inhibitors block conversion of androgen to estrogen. PDE inhibitors like sildenafil enhance nitric acid signaling, and androgen receptor blockers directly block androgen receptors. That is flutamide. Next.
Yes, sir. A 12-week pregnant woman has been on lithium therapy for BPD. Which of the following fetal abnormalities is most commonly associated with maternal lithium use during the first trimester? NTD, Epstein anomaly, cleft lip, cleft palate, CDH, gastroschisis. Sir, option B, Epstein's anomaly.
Yes, it is an abstinence anomaly. Lithium exposure in the first trimester is associated with an increased risk of abstinence anomaly, a congenital malformation of the tricuspid valve, characterized by downward displacement of the septal leaflet. This defect leads to the arterialization of a part of the right ventricle and can cause cyanosis and heart failure in the newborn. Other congenital anomalies like neural tube defects are associated with folate deficiency or other drugs, valproate, not lithium. Cleft lip, palate, diaphragmatic hernia, and gastroschisis are not linked to the lithium exposure.
Yes, sir. The antibacterial action of benzyl penicillin is primarily due to inhibition of bacterial protein synthesis, disruption of bacterial cell membrane integrity, inhibition of folic acid synthesis, inhibition of bacterial DNA gyrase, inhibition of bacterial cell wall synthesis. Sir, option E.
Bacterial cell wall synthesis. So, inhibition of the bacterial cell wall synthesis is the answer. Benzyl penicillin, also known as penicillin G, is a beta-lactam antibiotic that exerts its antibacterial effect by inhibiting the synthesis of the peptidoglycan layer of the bacterial cell wall. It binds and inactivates the penicillin binding protein PBPs, which are crucial enzymes in the final stages of bacterial cell wall assembly. This weakens the cell wall, leading to osmotic lysis of the bacteria, and particularly in the gram-positive organisms. Next.
Yes, sir. During an open appendectomy, the surgeon carefully ligates the artery supplying the appendix. This artery is branch of which of the following? Inferior mesenteric, inferior mesenteric, right colic, ileocolic, middle colic. Sir, option D, ileocolic.
Yes, this is also a very frequently asked and repeated question. So, ileocolic artery is the answer. The appendicular artery is the main supply to the appendix and is a branch of ileocolic artery, which itself arises from superior mesenteric artery. The appendicular artery travels in the mesosalpinx to reach the appendix. Damage or inadequate ligation of this vessel during appendectomy may lead to the bleeding or ischemic complications. Next, doctor.
Yes, sir. A 68-year-old postmenopausal woman presents with small red mass at the urethral meatus and complains of mild dysuria. On examination, the lesion is soft, vascular, and located at the posterior lip of the external urethral meatus. What is the most common underlying cause of the condition? HPV, chronic urinary tract infection, urethral malignancy, estrogen deficiency, pelvic organ prolapse. Mild dysuria, soft and vascular. It is vascular. Sir, option
Which one?
E.
Estrogen deficiency. Urethral caruncle is a benign inflammatory vascular lesion commonly found at the posterior lip of the urethral meatus, especially in the postmenopausal women. The most common cause of estrogen deficiency, which leads to the atrophic changes in the urogenital tract, making tissues more susceptible to irritation and inflammation. These lesions are usually asymptomatic but may cause discomfort, dysuria, or minor bleeding. Next.
Yes, a 45-year-old woman is scheduled for an MRI scan with a contrast to evaluate a suspected brain lesion. Okay, the radiologist explains that a contrast agent will be used to enhance the image quality. Which of the following contrast agent is most commonly used in MRI scan? Iodine-based contrast, barium sulfate, gadolinium-based contrast, technetium 99, FDG. Sir, option C.
Gadolinium based contrast. MRI is always gadolinium based contrast agents are the most commonly used contrast agents in MRI. Gadolinium is a paramagnetic metal that alters the magnetic properties of the nearby water molecules, enhancing the contrast in MRI images. It is especially useful in detecting lesions with increased vascularity or disrupted blood-brain barriers. Unlike iodine-based contrasts, which are used in CT, or barium sulfate, which are used in GI imaging, gadolinium is specifically suited for MRI. Next.
A 32-year-old woman is diagnosed with gestational choriocarcinoma following a molar pregnancy. Okay, staging investigation are conducted to evaluate the extent of disease spread. What is the most common or predominant route by which choriocarcinoma spreads? Lymphatic, local invasion, peritoneal, hematogenous, transcelomic. Sir, option D, hematogenous.
D. Hematogenous spread. Choriocarcinoma is highly malignant gestational trophoblastic neoplasm known for its early and aggressive hematogenous spread, particularly to the lungs, which are the most common site of metastasis. It can also spread to the brain, liver, and other organs via bloodstream. Unlike many other gynecological malignancies, lymphatic spread is less common in choriocarcinoma. Next.
A 26-year-old man presents to the STD clinic with multiple painful genital ulcers with unilateral inguinal lymphadenopathy. Okay. Soft Sanker, the ulcers are soft with irregular borders with purulent base. Which of the following STI is most likely caused by Haemophilus ducrei? Syphilis, lymphogranuloma venereum, chancroid, genital herpes, granuloma inguinal. The option C, chancroid.
Yes, H. ducrei, it is a chancroid. Chancroid is a sexual transmitted infection caused by gram-negative bacillus Haemophilus ducrei. It is characterized by painful, soft genital ulcers with ragged edges and often associated with tender unilateral inguinal lymphadenopathy that may suppurate. This contrasts with syphilis, which is a painless ulcer, and herpes, multiple painful vesicles or ulcers, often bilateral lymphadenopathy. Next.
Yes, sir. A 70-year-old woman is being evaluated for treatment of overactive bladder with urinary urgency and frequency. Her medical history includes open angle glaucoma, constipation, and a recent episode of acute urinary retention. Which of the following condition is an absolute contraindication of prescribing oxybutynin? Open angle glaucoma, irritable bowel syndrome, hypertension, myasthenia gravis, and osteoporosis. Anticholinergic. Sir, option B, IBS.
It is D. Myasthenia gravis. Oxybutynin is an anticholinergic medication used to treat overactive bladder. Myasthenia gravis is an absolute contraindication because anticholinergic agents can worsen the muscle weakness by interfering with the acetylcholine at an M junction. Other contraindications include urinary retention, gastric retention, uncontrolled wide-angle glaucoma. Remember, it is uncontrolled narrow-angle glaucoma. Okay, not the wide-angle, but not the open-angle glaucoma. Okay, so myasthenia gravis and narrow angle glaucoma. These are the contraindications. Okay. Next.
Yes.
Yeah.
A 16-year-old adolescent presents with abnormal vaginal bleeding and a palpable mass in the upper vagina. Okay. Abnormal vaginal bleeding and palpable mass in the upper. Her medical history is significant for in utero DES exposure, as a mother was treated with DES during pregnancy. Which of the following neoplasm is most likely in the patient? Embryonal rhabdomyosarcoma, sarcoma botryoides, squamous cell carcinoma, vaginal clear cell adenocarcinoma, leiomyoma sarcoma, malignant melanoma of the vagina. So, rhabdomyosarcoma.
Young patient, DES exposure. This is also Yes, it is a clear
Clear
cell
cell
carcinoma. Clear cell carcinoma. Vaginal clear cell adenocarcinoma. DS exposure in utero is strongly associated with development of clear cell adenocarcinoma of the vagina and cervix in young women, typically presenting in adolescence or early adulthood. Embryonal rhabdomyosarcoma, that is sarcoma botryoides, presents in infants and very young children, often with a grape-like mass protruding from the vagina, but is not linked with the DES. Squamous cell carcinoma, leiomyosarcoma, and melanoma of the vagina are less common in this age group and have no known association with DES exposure. Next, doctor.
Yes, a 10-year-old child presents with bone pain and going of the legs. That test reveals low calcium and vitamin D levels. Okay. Supplementation of the vitamin D is initiated. In which of the following organ is the active form of vitamin D primarily produced? Skin, liver, kidney, intestine, bone. Sir, option C, kidney.
Yeah. So 125 happens in the kidney. Okay. The active form of vitamin D, known as 125 hydroxylation, hydroxy vitamin D calcitriol, is produced in the kidney through the action of the enzyme 1 alpha hydroxylase. The skin synthesizes vitamin D3 cholecalciferol from 7D hydrocholesterol under UV light. The liver then converts it to the 25 hydroxy vitamin D, that is calcidiol. And finally, the kidney converted to the active form calcitriol, which is crucial for calcium absorption and bone health. Next.
Which of the following human chromosome commonly shows a secondary constriction associated with the nucleolar organizing region? Chromosome 6, chromosome 13, chromosome 18, chromosome X, chromosome Y. Chromosome 18, sir. Option C.
It is chromosome 13. Chromosome 13, 14, 15, 21, and 22. Acrocentric chromosomes show secondary constrictions associated with nucleolar organizer regions, adding in nucleolus formation. Remember these numbers, okay? 13, 14, 15, 21, 22. These are the question can be on acrocentric chromosomes also, okay?
Yes, sir.
Next.
Which banding technique is most commonly used in routine chromosomal analysis during karyotyping? Q banding, R banding, T banding, G banding, C banding. Sir, option D, G banding.
So it is a G banding. GIMSA banding after trypsin treatment is the most commonly used banding technique for routine karyotyping, providing a clear pattern of light and dark bands to identify chromosomes and structural abnormalities. Okay. So this finishes the today's topic on the mixed bag. Thank you.